All of you for all right, we're now recording, so fantastic. Welcome to everyone. We are in person here at Miller Street, and I'm going to read our commission purpose. We are calling this to order at 2:03 p.m. on June 1st, 2026. Our commission purpose is the legislature finds that there is a need to establish a body to improve the state's interface with members of the lesbian, gay, bisexual, transgender, queer plus community. Identify the short and long-term range needs of its members and ensure that there is an effective means of researching, planning, and advocating for the equity of its population in all aspects of state government. Accordingly, the purpose of this chapter is to establish a commission to provide for a statewide program on a permanent and continuing basis on the status of lesbian, gay, bisexual, transgender, queer plus individuals in Hawaii. So we're going to call this to order, and we've got our introduction and roll call. So I'm here, Sandy Harjo Livingston, the chair. Next, we have Michael Goliu, Jr., vice chair.
Here, present in the room by myself.
Thank you. Next, we have Finance Director Shanda Brack.
Aloha, I am here and by myself.
Thank you. Next, we have Philip Steinbacher, but I believe he is out traveling, so he's not here. Next, we have Kathleen Odell, who is traveling but is here. Thank you.
I'm here and I'm alone in the room.
Thank you, Kathleen. Next, we have Joe Tolbert from Maui County.
He just texted me. He's trying to get on right now.
Okay,
we might give him a few minutes. Yeah.
Okay, we'll come back to him. All right, next we have Richard Velasquez from City and County of Honolulu.
Good morning. Happy Pride. I'm here by myself.
Thank you. And next we have Christopher Luthi from Hawaii County.
He just texted he's not going to be able to make it.
Thank you. All right. And we're still waiting on Joe to get in?
Yep.
All right. Next, we have Superintendent of Education Designee Beth Schimmelfennig, Director of the Department of Education Civil Rights Compliance Office.
Aloha, I'm here and I'm alone in the room.
Thank you, Beth. Next, we have President of the University of Hawaii System Designee Dr. Cameron Miyamoto, Director of the LGBTQ Center, UH Manoa.
Present, alone in the room.
Thank you, Cameron. Next, we have Director of Labor and Industrial Relations Designee David Rodriguez, State's Equal Opportunity Officer.
Aloha, David Rodriguez. I'm here alone in my room.
Thank you, David. Next, we have Director of Human Resources Development Designee Signe Nakamura Dereza, EEO Administrator.
Hi, I'm here and alone in the room.
Thank you. Next, we have Director of Human Services Designee Jonathan Kabura, Executive Specialist.
Hello, President. No one else in the room with me.
Thank you. Next, we have Director of Health Designee Thaddeus Pham, MPH, Viral Hepatitis, Prevention Coordinator, Harm Reduction Services Branch.
Aloha, everyone. Thaddeus Pham, he, him. There's no one else in the room with me.
Thank you, Thaddeus. And then we have Staff Penny Bulligay, Administrative Assistant, Department of Human Services. And we love Penny, so thank you. All right, is Joe, has he made it in yet? Nope, all right. Next, we have our members' shares and concerns and reports. Sandy, me, chair. Well, I'm gonna say, I am concerned that we have a chair for a Democratic Party for the state who is not willing to protect trans rights. So I wanted to make sure that's on record that I am concerned about that. And I'm hoping that we will be able to work over the next couple of years to see how that works out. We also have the Rainbow Film Festival coming up. That is in July. Hopefully you all will be able to make it out to that. We'll be showing several queer films locally as well as internationally, things that are speaking to local experiences and things like that. So it's going to be a good experience, and that's going to be in July. All right, Michael, you're next.
Just reminding everybody to get out there and make sure all their friends are registered to vote and that they do vote in the upcoming elections, both here and on the continent. And that we are still waiting on the Supreme Court case that will have grave impact on transgender students and their ability to play sports. So be on the lookout for that coming up. We're still waiting for SCOTUS to come out on that one. And so, we're probably going to lose that one. So just be prepared, and we got to figure out how we respond in kind when that happens. And
Yeah,
that's all I got.
All right, next we have Shanda Brack.
Aloha. Just want to thank the governor for signing the Gender Affirming Care Shield Act and thank all of the many, many people who worked their butts off to make it happen, and all the legislators that voted for it. So thank you, everyone, for that. And I got this from an epidemiologist friend of mine who recently posted. I'm shamelessly talking about what he posted. If you care about or are unsure what to believe about transgender people, ask ChatGPT. So if you have questions about vaccines or transgender people or LGBT people, and you've always been afraid to ask things that would be impolite to ask them in person, you can ask ChatGPT, get real information and surprisingly medically accurate information. And it's kind of an awesome way for people to educate themselves without feeling silly. So try it.
All right, wow, great advice. Next we have Christopher Leafy's not here. Next we have Kathleen.
I also agree with your concern, Sandy, absolutely, and I am saddened by that decision. But I would just like to say thank you for 2 years of serving on this commission. It has been a time, and I've greatly appreciated the opportunity and getting to know all of you better. Thank you.
Thank you, Kat. We really appreciate everything you've done. This isn't your last meeting. You're coming next month, right?
I think I don't know. You should check. It's my last. I think it's July 1st is the end. So right. So no, this would be my last meeting.
Oh, okay. I apologize. I thought it was through the 31st. Okay.
Not that I can't
Well,
come,
I
but it
want
won't
to
help
say-
your quorum.
Okay. Well, I want to say thank you for everything you've done. Your service to the commission has been invaluable. You were an incredible chair for our first year, our inaugural year, and we could not have done it without you. So thank you.
Thank you so much.
All right, Joe, we're gonna go back to attendance really quickly to pick up Joe. Joe Tobin,
I'm here, sorry, alone.
you're alone, thank you.
I thought it was,
And you're just in time because you're next up for for Commissioner Shares and Concerns.
let's see. Share, we're getting ready, hopefully for, our Maui festival next week, Saturday. I know they're going crazy because our head person is in, the hospital, fingers crossed, he's, I don't want to say anymore. Just wish him prayers sent to him from everybody. Thank you. He called me yesterday to if I could cover for him for the hike that morning, in case he's not here or in the hospital or at home. I was like, what? And then I found out that's when he was in the hospital. So yeah, I probably won't be there at the very beginning to welcome you guys, but I'll be covering the hike for him that he usually is does starting out our events that morning. One other thing, oh yeah, he got the well, I don't know who in the organization got the table and chairs for the two flying over, I guess, coming for that event. I don't know another thing. Oh, I'm sorry, I was totally asleep when Rick got me up saying, "Are you coming for the meeting?" I said, "What?" So I thought it was next week Monday. I'm so sorry, everybody. Oh, and thank you for the ones who made it for the flag ceremony this morning. I appreciate I wish I could have been with everybody with there. And I heard our Miss Torres Amato and Dr. Joe Ritter were there representing Maui. Thank you to them. I love them for doing that.
Thank you, Joe. All
Yeah.
right, next
Okay.
we have Frank Velasquez.
Oh, aloha, everybody. Happy Pride. Thank you for 2 years as our inaugural commission, as my term is also expiring. Good to see it was a bright spot this morning in all the bad news to see the flags going up. And we got a whole lot of flags from Michael got them, I think, from Dean and Joe. So thanks so much to those guys for doing all that. And I was very pleased to see our governor and Representative Amato there. And I know that they're having a flag raising in Maui too, I believe, coming up. And I wanted to say that I also heard that there's now a vice chair at the Democratic Party that was elected over the weekend that is very supportive of our community. I'm not sure about details on that, but again, let's look for some positive things today. And that's all. Thank you.
Thank you, Rick, and thank you for your service to the commission for the last 2 years. We're gonna miss your presence. You've been a great advocate for us. Thank you.
Thank you.
Next we have Superintendent of Education Designee Beth Schimmelfennig.
Hi. Just like you, we're just watching what's happening nationally and hoping that we can protect our students. I think that one thing I'd like to say is our state is inclined for protecting our LGBTQ plus students, and anyway, I just want to extend that we are very supportive and hoping that we can continue that in light of what's happening nationally.
Thank you. Thank you, Beth.
Sandy. I'm sorry, Sandy.
Yes.
That was something I forgot. I did want to take the opportunity before I leave to share my mahalos and aloha for our ex officio members. A lot of them have been coming for a long time. So Beth has been here forever. Signet, David, Thad, you've been awesome. Cameron, and John, all of you guys have really gone. Who did I forget? I just left somebody out. That's not enough. But whoever, I just wanted to say you guys have been awesome, and you don't get any of the credit. You're kind of our unsung heroes behind the scenes, but we really, really appreciate you. Mahalos.
Thank you, Rick. Next we have President of University of Hawaii System Designee, Dr. Cameron Miyamoto.
I just want to start by extending a big mahalo to all the inaugural commissioners. Thank you for all of your amazing service and dedication to our communities. You will be missed, but I know you'll continue to rock it out there. I also want to announce Gender Journey Days that we've been talking about, and to remind folks that it will be happening July 11th at the UH Manoa JABSM, John A. Burns School of Medicine, for the 3rd year. Registration is still happening, so please take the opportunity and let folks know. And also just want to close by celebrating the gender affirming shield bill that passed, and thank you to everyone here who was a big part of making it happen with your testimony, your support, and to the community members here who were supportive of that bill. Thank you.
Thank you. Next, we have Director of Labor and Industrial Relations Designee, David Rodriguez.
Thank you. The Department of Labor and Industrial Relations is reminding individuals impacted by the Kona low storms that occurred that the deadline to apply for the disaster unemployment assistance benefit is June 15th. This applies to workers, business owners, and self-employed individuals in Oahu, Hawaii, and Maui. If they became unemployed or had their work hours reduced or interrupted due to the Kona low storms that occurred between March 10th and March 24th. Thank you.
Thank you, David. Next we have Director of Human Resources Development Designee, Signe Nakamura Juris.
Hi, just wanted to say the pride flags outside my window look great.
Oh, that's awesome. Glad you get to see those.
Yeah, me too.
All right, next we have Director of Human Services Designee, Jonathan Kimura.
Hi, everyone. Nothing to report from the department. However, on a side note, I did see the no hate banner that was up on the bus.
Yeah.
So that was nice to see. I didn't get to take a picture of it, but it was nice to see it up there advertising that. So
Oh, that's
good job,
fantastic.
everyone.
Thank you, John. All right, next we have Director of Health Designee, Thaddeus Pham.
Thanks everyone. I'll just echo first of all what John said. I was on the bus this morning and I saw the no hate thing. I was like, wow, yeah. Happy Pride, everyone. Just as a reminder that the Department of Health is supportive of all people's health, including sexual and gender minorities. So we continue to have a resource on the Department of Health website, including services for all people of all ages, like gender sexuality alliances, providers who provide culturally congruent care, and the transgender statement, the Department of Health statement on transgender health as a public health issue remains on the website as well. So just reiterating that the Department of Health continues to support the health of all the people, and to thank all the inaugural commission for their fantastic 2 years. I think it's closing, and for the great strides that you've made for our community. So thank you for that and keeping us healthy.
Thank you. Thank you. Okay, do we have any public testimony on member shares and concern or regarding, I guess it's not about our concerns, but I guess public testimony for your concerns. Nope. All right, great. Next we have our finance director's report.
Sorry, I'm emailing about an agenda item for next month. Okay, so finance report, I updated the report, and it looks like we are nearly perfect. We have spent 17,752 of the allotted $18,000. So $248 left to spare is what it looks like.
All right, that's fantastic. Well done to us. All right. Next, we have any official communications from state officials. I didn't see.
Just the proclamation we got this morning.
Yeah. Okay. Yeah. So the only thing is, well, most of y'all saw the proclamation that we got this morning. So, all right. Any public testimony on the finance director's report or the proclamation we got? No. All right. Great. Next, we have a presentation from Kokua Mau. It's a Hawaii-based nonprofit and statewide coalition focused on improving care for people with serious illness, especially around palliative care, hospice care, advanced care planning, and end-of-life decision-making. The name Kokua Mau, yes, right. Kokua Mau roughly means continuous care or ongoing help in Hawaiian, Native Hawaiian, or Olelo Hawaii, we'll call it that. They're joining us to highlight the need and the options we have, especially for those of us who are members of the LGBTQ+ community. Did they show today?
Aloha. My name's Jeanette Kojing. Can you hear me okay?
Yes.
Okay, great. I have been kicked out of my office by men jackhammering next door, so I'm mobile. Men at work. Okay, good. So can you clarify how long you would like me to talk? I realize I probably asked Shonda and forgot.
Oh, that's okay. Like 7 to 10 minutes.
Okay, great. So nice to see everybody. I saw Thaddeus and bought his bakery goods on Saturday. Usually we say it's so nice to see people in public. So Kokua Mau, again, thank you for the invitation, and I really appreciate the work you guys are doing, and hope that if there are things that we can do together, you'll let me know. So we are a statewide coalition going on 26 years of helping to improve care for people with serious illness. So we are a hui of all sorts of organizations and individuals that is committed to making that happen. And we approach this problem, this task in a number of different ways. I'm a public health person, so I always think in systems. So the first thing we try to do is get people good information. So people who may be facing serious illness and their loved ones, we want people to know about resources and information that's available. We do this in a variety of ways. So we have a very well-maintained website, 3.7 million hits last year. Oh my gosh. So we have all sorts of resources up there. We go out and we do talks in the community. Feel free to invite us. We love going to any kind of groups that are interested in the topic. We have a free newsletter that goes out. Send me a note, or you can sign up on the quick links on our website that talks about what's happening in our community. So putting people at the center of what we do. The second thing is we try to help professionals with education and networking so they can do their job better. I would say most of the 3.7 million hits are people downloading things like our free advanced directive, also in 13 different languages, all sorts of information to help people make decisions around serious illness. We also have all sorts of good information about palliative care, which is care for people with serious illness who are still pursuing curative treatments. Different from hospice, which again is the gold standard for caring for people at the end of life who have stopped with any kind of curative treatments. And here in Hawaii, we've really been pushing to increase the palliative care options that we have. And it's when I describe palliative care to people that it's this emotional, spiritual, and physical support for the person who's sick as well as their loved ones. Everyone says, wow, couldn't all healthcare be like that? So we've really been looking at how do we increase palliative care. So first thing is put people at the center. The second is professionals, networking, resources. And then we also look at policy and when forced legislation. So I prefer to try to do things differently. All of us suffer with the legislature. So I like to look at ways we can look at policy changes. Sometimes legislation is needed, but we all know if health insurance starts to pay for something, that can be a game changer. So those are sort of the things that we do. And right now, I think our main, the main emphasis, again, if you think 3 buckets, we really want people to understand what advanced care planning is, what an advance directive is. So I think especially for the LGBTQ community, it's really important to understand that you get to choose who would speak for you if you can't speak for yourself through documents, through an advance directive. And you get to choose. You do not have to choose blood relatives. You can choose who you trust. So I think that's really important. And, I should have started with, I come from the world of HIV and AIDS. I used to live in the Castro in San Francisco and am still traumatized by what happened before when biological families would show up and then, the chosen family was kicked out and other decisions were made. So I think it's important to say that you can do an advance directive, and again, free on the website. So I just save everybody $400. Don't let lawyers talk you into it. And you can designate who your people are. Name 2 people who would be your healthcare power of attorney. And then the second part of an advance directive is talking about what your wishes for the very end of life would be. So everybody needs an advance directive. Just putting that out there. Again, we love to go do talks with groups, any kind of group that invites us. We really like to break the ice and help people understand why it's important. And we usually say, better to be 10 years too early than 5 minutes too late. So in case any of you are caring for elderly friends or relatives, these are things you can do today. Or people with serious illness. As we know, unfortunately, they can be quite young. So for the advanced directives are really important to us. The second thing is POLST. I don't know if people have heard about it. It's a portable medical order. Again, not everybody needs a POLST. It's just really for people at the very end in the last year or two of life, but it's a very important medical document. And then the third thing we try to do is help people understand what palliative care is and why this is such an important option. So if you are wondering, what the heck is palliative care? What is Jeanette talking about? I invite you to go to the website. You can see we have short videos, we have some testimonials, there's little quizzes to help people understand what palliative care is. Again, it's different from hospice because you can still be doing curative treatments, but the emotional, physical, spiritual, social suffering and issues and problems that come up can also be addressed. And palliative care is also a team, usually doctor, nurse, social worker, chaplain, but other people can be brought in as well. So I really hope people are interested. You know, again, if you sign up on our newsletter, you can see where we have all sorts of information about palliative care and what's going on. I did want to say we are very, in Hawaii, we have more palliative care than most other places, and we are the first state in the country that has a Medicaid, so in our case, MedQuest, approved palliative care benefit. And it's we're in the second year, ramping up. I wish health plans would move faster, but anyway, we're moving. People are being cared for. You know, literally hundreds of people have already gotten into these programs, and it's a unique program. So one of the things we have on our website is where can you find palliative care in Hawaii, and hopefully you can join the 3.7 million people that went to our website to learn more about palliative care and what it is and how it can help. I'm the first one to say that we try to include good resources that are out there. We have a very small staff, so I look to our community to share good resources. If you find things that are in this sphere for LGBTQ folks, please send them along. We can, you know, to be included. We have, I hope that most of the materials that we have are not, you wouldn't feel excluded. We try to, you know, we live in such an interesting place with many different people. So I really hope there's nothing on our website that you would feel excluded. But if you find resources, and actually I saw Thaddeus because on Saturday I was invited to a thing that the geriatrics department was working with harm reduction. Was a group of Mahu, so Kapuna Mahu, talking about their issues, and they were really interested in chosen family making decisions. And there's a document now that they are working on, and as soon as that's done, we'll upload that helps people to write down what matters most. So for us, it's not so much what's the matter with you, but what matters to you, and making sure those important things to you, to us, are carried on throughout your care, and that everyone on your care team understands that. And so we're very open to finding good new resources. So I have no idea if that was 7 minutes or whatever, but I'm very happy also to take questions, and, you know, Sandy, whatever you'd like to do.
Well, that was amazing. And I was just looking at that. So we have every citizen in Hawaii coming to your website at least 2.5 times per year. That's absolutely incredible. So I think Joe has a question.
Yes, Jeanette, are you able to fly over to Maui and do a presentation of what you just told us about?
So, you know, to be honest with you, we have a small staff of 2. And, but we're very happy to work with people. My colleague Hope is actually going to Maui in June. The Alzheimer's Association invited her to come, and she's going to come early and go do some talks over at Halemakua. So send me a note. I'm happy to work with somebody, you know, basically it just takes the airfare, or we could do something via Zoom. You know, we work with a number of folks on Maui and in Maui County. But, I won't say we're cheap, but if you can give the airfare, that gets us there. We unfortunately don't get any state funding at all. So I try, but usually no one is sympathetic. Richard, you had your hand up?
Yes, please. Do you take direct referrals of clients and provide information referral or case management until you can link them with somebody else?
We try very hard not to, because what happens is people will then send all of their patients to us. If you send me a note for a person, it's one thing, but really what we want to do is build the skills of the existing social workers, nurses, doctors, what's out there, or wherever people sit, community health workers. So we do not have the capacity to do that. Now that I've met you, Richard, if you have a case, don't worry about contacting me. But no, actually, I got one day HMSA decided to send everybody to us. So we had 12 calls in 1 hour. Yeah, please no. But we love working with professionals. How can we help professionals to understand the resources that are there and talk to people? So that we really like doing that. And I'll be, we go to all kinds of different places and talk to people, and it's a topic some people choose to ignore or pretend that it doesn't exist. And okay, but if you find, we all know that these are really important issues, that it's better to be talking about them. So we'll talk to almost anybody.
Jeanette, I just sent you my email. You can get a hold of me that way.
I'll send you a note when we're Paul here.
Okay, perfect. Thank you.
Yeah. Yeah. And again, we're happy to do a Zoom thing, could tell you about what we do. Usually most of the trainings we do start with what we call advanced care planning. So getting people comfortable, talking about what matters, who matters, and then hopefully completing that advanced directive, which is so important for naming who your people are. If you don't do it in Hawaii, you can end up in guardianship, which takes about 6 months. A good thing is we don't have a next of kin, so it doesn't mean that your sister would show up automatically and make decisions for you. But as much as I love my sister, I really don't want her making decisions for me. So just a heads up, we all get to choose, but we have to choose. And if you just leave it to the universe, that's not a good plan. So I really hope that people will hear that. And again, does not need to be a biological family member. It's your chosen family, and you get to choose who would speak for you. And then you share that with your healthcare team, you share that with other people, and that's how your wishes are honored.
Thank you.
Yeah, or do we have any other questions?
I have a question, Thaddeus, and I just saw Jeanette recently, but I remember Jeanette we talked about this before. And so the advanced care directive and the pulse are kind of when you're, end of life care, but there's also a separate thing that you create for hope, right? For your wishes in terms of like funerals and things like that. That's a separate document, right, Jeanette? I just wanted to clarify if that is that
yes.
correct?
Okay. And so an advanced directive we all need to designate who our people are. And then if something happens, if you get in a car crash or get hit on the head by a surfboard, who would speak for you? The advanced directive also includes if you are coming to the end of your life, you can designate some wishes that you have. A post is different because a post is a medical order, a portable medical order. So signed by a physician, APRN, or a physician assistant. And that documents what the care plan is outside of a hospital. So if someone's in long-term care, if someone's at home, any care setting that is not a hospital, that's how you designate what the plan is. And that is specifically important for people who have decided, like if they die in their sleep, that we would allow a natural death and not be resuscitated. or if there's certain things that people want to avoid. They've been to the ICU, they don't want to go anymore. There's certain things they don't want to do anymore. So it really helps patients to document and with their, with their providers, what the plan is. So that's a post. Again, not everybody needs a post. It's also the way EMS, like if you call EMS, they can act on a post. They will not act on advance directive because that is not a medical order. And then once someone has passed away, there is the whole other world of funeral. And I will say, there is no way really to 100% guarantee that your funeral is going to be the way you want it to be. So you really need to be working with loved ones ahead of time if it's important to you. I mean, I know stories of people who died over the weekend and they were already in the cemetery by the time the family showed up. So but you can document, people go all out. They can talk about the hymns they want, or what the concept of a make box in Hawaiian, where you can put in what you want to be buried in, your hymns. Those kinds of things are quite common, but that you need to really put work into what those wishes are. I would encourage people, since you asked Thaddeus about the funeral part, some of the mortuaries have packages that you can buy ahead of time. And right now we have this kind of difficult situation because people bought stuff 15 years ago, 20 years ago, and they bought and thinking it was all taken care of. And now they've been bought by somebody else. And now they have like half of what they thought they were going to have. So one of the very well used documents on our website is a price list for mortuaries. And you can see there's a huge difference. And don't ask me off the top of my head, I don't remember, but like some of them are $3,000 more than others for doing exactly the same thing. So it's actually like, whoa, what's going on here? And it's much better to make all those plans ahead of time, because when it's so stressful, of course, when a loved one dies. So those are things you can do, but you can't really just sign. It's not like you can't really just sign a document and guarantee it's going to happen. So, but hopefully if, for instance, if someone's in hospice care, that they would be already talking about what the wishes are, getting things in place so that a family member couldn't swoop in and make something else happen.
Awesome. Thank you, Jeanette. Yeah, and the reason we ask it, I think Shanda's heard this too, is just community members who are of a certain gender who are then changed after the funeral, and their hair is cut or they're put in clothes that are not appropriate to them. So that's why that was important for us. So thank you for that.
Yeah, no. And Thaddeus, first of all, if people hear of that, that's really shocking. And I would, I'm very happy to try to pursue where that's happening, what we can do about that. We can go visit. And also if people aren't willing to stop doing such a horrible thing, make that known. I mean, I don't know if there's a rainbow seal of approval for mortuaries, but that seems, that's appalling. And so I actually, don't tell them, but I was invited to the Mortuary Association last year, which was pretty interesting. So we could certainly pursue that. Most people seem to be, good people, but I'm constantly surprised at what happens. So Thaddeus, if you have any examples, or if there's something we should pursue, let me know.
Thanks, Jeanette. I will. And I think Shannon and I have brought this up during the aging work group meeting. So I think we'll probably approach it there offline. Yeah, with you. Thank you.
Yeah, and similar to, care homes not honoring somebody's, trans people's chosen gender orientation, like all of that is totally unacceptable and appalling. So let's work on it.
Any other questions? Signe, I think Signe. Oh, no, that's just our point your hand. Never mind. Okay, so thank you so much, Jeanette, for coming by and explaining this to us. It's shocking that we don't want to get any state support with how much you are helping people with their end of life plans, especially the amount of hits you're getting from Hawaii. So
Well,
good luck
and
with
yeah,
that.
I tell you, if anyone has ideas, Department of Health links to us, everybody links to us, and no one can figure out how to support us. All the funding went away 2 years ago. So I'm always open to good suggestions, even with small contracts. So let me know.
All right, great call out. Any of y'all know anything? You know what to do. All right, thank you so much, Jeanette. All right, next we are moving on to ongoing business and updates. The first thing we're going to talk about is update on commission's website. Michael.
The website's been updated. It has the link on there for our legislative survey, as well as we'll be leaving the bus poster, we'll be leaving the bus poster graphic up there. And so yeah, so if you have anything else you would like to see on the website, please let me know. We'll get that done.
Fantastic. Do you have any public testimony on the update for the commission's website? All right, next we have update on letter to Maui Preparatory Academy donors regarding Maui Preparatory's anti-LGBTQIA+ policies for students.
We did not get any other feedback since our last meeting. So next month we're probably going to look at how we can continue to support the parents and the students at Maui Prep, because they're still continuing with their bigoted anti-trans policy.
Yeah, there's a lot of movement on that island to really push that. So it's starting to get really concerning in that area. Joe, you may want to keep an eye out, keep us updated. All right, up next is the update on the next Rainbow Pauhana Queer Community Leaders Gathering. I know we were still looking for a space. I wasn't able to find anything. Michael, do you have an update?
I do not at this time. We're still looking to hopefully have something then in June. But we'll keep, if anybody wants or is able to, has capacity to be a host for us, let us know. Otherwise, there's gonna put some other feelers out.
Thank you. I need to go back really quickly. I skipped public testimony for the Maui Preparatory letter. Do we have any public testimony on that? No. All right. Next, do we have any public testimony on the next Rainbow Pauhana update?
So since I'm the public,
Oh, excellent.
what kind of space are you looking for the Rainbow get together?
So we're looking for a space that's going to be able to accommodate anywhere from 30 to 60 people. It is organizations around Oahu and really anywhere in Hawaii if they're here, if they come here, to get together, meet one another, and exchange information, let them know, so that everyone knows what other people are working on, what kind of resources are being offered. And it's really just a time for people to meet, connect, and collaborate and network.
So that doesn't have to have free beer or something.
Oh, no.
Just checking.
Yeah, no, it's not like the typical Pauhana that is festive. This is more of a networking, coming together so that we can understand how to be more of a cohesive unit and making sure that people are taken care of, rights are covered, access is, all those different things that we need to ensure our community is taken care of.
So I don't know if you asked Church of the Crossroads, but they do all kinds of things. I should say I'm a member of Church of the Crossroads, and our interim pastor is queer, and she said yesterday, how do I meet nice queer people? And so not that I'm, trying to set her up, but I just think anyway, Church of the Crossroads usually very open. It's just a matter of availability, but you can feel free to reach out to me, and I'm happy to help facilitate that.
That was my next question. If you could connect me with them, that would be great.
Yeah, but no free beer. Okay.
No.
Thank you for laughing at my jokes. It's very good. Okay.
Oh, you're welcome.
The only other requirement is that they have access to Wi-Fi, because we do it via Zoom to bringing everybody. So since it's for across the state.
Yeah, it'll be pretty low tech, Michael. So if you need something high tech, there is a Wi-Fi, and that's not a problem. But then you'd have to. Would you also be setting up the Zoom?
Yeah, yes. we use our Zoom.
You bring the equipment. Okay.
Yeah.
Good to know.
Okay.
All right, thank you, and I'll connect with you after the meeting so that we can get that taken care of. All right, do we have any public? No, that was the public testimony. Okay, so next is update on addressing the needs of our community's kapuna, especially Mahu, trans, non-binary, and intersex. Shanda?
Aloha, thank you. And well, we've been working with Kukua Mau. So thank you, Jeanette. I really appreciate you coming and sharing what you guys do and increasing exposure to our community and giving us options and reminding us of what nobody wants to think of is what could happen end of life when things don't go our way. Our 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 little hui is moving forward with the the research that Dr. Stuppelbeam and Michaela are doing on finding out what the specific needs of our trans kapuna are in Hawaii and starting to do educational trainings to improve care. So we are working on that. The project is moving forward. I'm not working on it. They are working on it, and the project is moving forward. And it's getting a lot of traction in the community, which I think is amazing. And that's my only update. Thank you.
Fantastic, Shanda, thank you. Do we have any update? I'm sorry, do we have any public testimony on the update on addressing the needs of our communities, especially Mahu, trans, non-binary, and binary, and intersex? Nope. All right, great. Next, we have a review of the 2026 legislative priorities via the 2026 legislative tracker.
Okay.
Michael.
Yeah, since we've last met, we've had 4 of the bills that we testified to be signed into law. Of course, the first one being Act 59, that HB 1875, that protects access to gender affirming care. Again, thank you to everybody who submitted testimony on that. Thank you to the governor for signing it into law on Friday. As well as we do want to send another mahalo out to Representative Adrian Tam for helping move that along through the Equality Caucus, and Vice Speaker Linda Ichiyama for her invaluable help behind the scenes, and then of course to Abby Simmons, who was the lead advocate for the grassroots, and she did an amazing job of putting together a coalition to push that forward. So let's see, on May 26th, the governor signed SB 2143 into law. That's Act 25. That is the order of succession for the offices for the chief elections officer. Much to the chagrin of our election deniers, there is now a order of succession, and our elections can now be certified if they are able to fire or something happens to the chief elections officer. So yay, that protecting elections is always a good thing. The Hawaii Civil Rights Commission got their bill that allowed the SB 2727 is now Act 56, that extended the time the statute of limitations for people to file a complaint with the Hawaii Civil Rights Commission. It extended it to 1 year, especially since nothing's happening at the federal level. With anything, unless you're a white man, you can file discrimination. Everybody else, anyways. I'll leave it at that. And then last but not least, on Friday as well, Governor signed SB 2239. That is the automatic voter registration into law. So anytime you go get a new ID, a driver's license, you will automatically be registered to vote unless you opt out. So automatic voter registration, yay. And that's Act 67. So there are 2 other bills that were enrolled to the governor we're waiting to see action on, and that is SB 2268. That is public accommodations, universal changing accommodations for new constructions. And so hopefully he will sign that into law soon. And then the other one is from our friends over at Planned Parenthood, HB 1961, that healthcare facilities making that you cannot bully somebody as they're trying or get in the way of someone accessing healthcare facilities. And that's for those wonderful people that come to our meetings and disrupt our meetings. They're the ones out on the streets there disrupting people's access to healthcare. And that is, rumor has it, he will be signing that into law later this month. So Um, and thank you everybody who reached out to the governor asking him to sign both those bills into law, and we look forward to seeing those become law. And on July 1, everybody, we need to celebrate Act 59 because that's when it goes into effect.
Excellent. All right, let's see here. Update on legislative survey at the end of 2026 legislative session, link to 2027 survey.
Like I said, it's on our website. We've been pushing it through the social media. We have been getting, we haven't got as many responses as we had last year at this time, but we, thanks to Hanny, we will have these flyers at the thing for people to sign, QR codes at our Pride events, as well as the AIDS walk. And so I encourage everybody to have their friends send the link to their friends as well to get so we can get feedback and everybody for looking towards the 2027 legislative session.
All right, do we have any public testimony on the review of the 2026 legislative priorities via the tracker, or an update on the legislative survey for the year 2026? Nope. All right. Next, we have update on Hawaii Coalition for Civil Rights. Rick?
Okay, again, the group has moved to primarily focusing on immigrant rights at this time. They've been doing that, but they have a number of programs. They have information available. I can link anybody to their ongoing. They provide a lot of information through their website. They won't be meeting the month of June, and they hope to start meeting again in July. But that has been their primary focus, though, is on immigrant rights and what we can do. They currently are training people to audit trials and things like that. And so that's it for now.
Fantastic, Rick. Thank you. Do we have any public testimony on the update for Hawaii Coalitions for Civil Rights? Nope. All right, great. Next, we have an update on statement condemning medical organizations abandoning MAKU, transgender, gender nonconforming, QT plus community and or meetings with medical organizations in Hawaii. Shanda.
Aloha, thank you. You know, I was just talking this morning about adding an agenda item for next month, which I am going to add an agenda item for next month to discuss something specific, but it is related to this. So I'm going to just bring it up now as to give you a little tidbit. So one of the things that has happened in my life is people come to me and they talk about the challenges they have obtaining gender affirming surgery, insurance companies denying them and giving them weird obstacles and not really following the law or statute in adhering to insurance requirements. And so random obstacles being included. And I do have one person reaching out specifically wondering if there's anything the commission can do. And we're not here to help one person. However, I think that we can draw attention to the insurer's lack of adherence to law and statute when it comes to insurance. And so I'm thinking that we can discuss next time the possibility of maybe posting on social media or requesting input from the community about their experiences, the barriers they've experienced trying to get gender affirming surgery in particular. And if we have a handful of people that are willing to share their stories, then that would give us a little bit more oomph in reaching out to the insurers to encourage them and to support and assist them in adhering to being decent and giving people healthcare that they're legally entitled to. So if people have thoughts, bring them to the next meeting, and hopefully we can do a little bit here.
Thank you, Shanda. Do we have any public testimony on?
Before we get to public testimony, Shanda, if we can always invite the insurance commissioner to come talk to us. Our good Scott Psyche, former speaker Scott Psyche, have him come, and then if you draft a letter for us to send, requesting him to send a letter to all insurance companies, reminding them of what the statute says with regards to gender affirming care. So we're not just we're helping one person, but we're helping everybody at the same time.
Yeah, that is exactly the kind of thing that I was looking for. Yeah, and it sounds like you know him. Do you want to invite him for maybe come next time and we can discuss it all at the same time?
Oh yeah, Scott and I go way back.
Awesome. Great.
All right, do we have any public testimony regarding an update on statement condemning medical organizations abandoning MAHU, transgender, gender nonconforming, and QTPI community and/or meetings with medical organizations in Hawaii? Nope. All right, great. Next, we have update on no hate in the 808 ad campaign regarding Hawaii non-discrimination laws. Michael.
Well, I'm glad to hear the bus ads are still up. They are supposed to come down today, unfortunately, because it's going to be 1 month already. We will follow up with, I'm going to follow up with the Hawaii Civil Rights Commission to see if they've seen a spike in people reaching out to them, finding out how to file a complaint and whatnot. I can tell by the bit.ly link QR codes is that they've had 35 scans from the QR codes themselves. So and then I can tell that I can't see what ours are, but I can see the Commission on the Status of Women, they've had 25 scans, the QR codes that are on the bus ad. So that's good. And it's good that we are going to be following up with Maui and Kauai counties to see how we can, because we still have enough bus signs for them as well. We printed enough to get all 4 counties. So and we'll see. And hopefully the Hawaii Civil Rights Commission can give us an update if they saw a spike. But anyways, so there you go.
All right. Do we have any public testimony on update on no hate in the 808 ad campaign regarding Hawaii's non-discrimination laws? No? All right, great. I'd like to really quickly go back. We had a guest that I had invited today, but they had not come until just now. So I wanted to introduce Jadelle Fujinaka. She's Mahu, and she is running for our state legislature. And I just wanted to introduce everyone to her. Everybody say hello. Hi, Janelle. All right. Next, we're going to be moving on to update on developing written protocols, procedures, and record keeping for the commission. Oh, Shanda. Oh, wait, sorry. I skipped one. Apologies. Update on City and County of Honolulu proposed charter amendment to create CNC Honolulu LGBTQIA plus commission. Michael.
Good news on that front. It got this last vote last week. Unanimous consent from the commissioners. It now goes on to the style phase. And once it comes back to the commission, it's going to be one more time that we're going to need to submit testimony in. We have the second highest count of like 107 pieces of testimony in totality. And so hopefully that will be enough to keep us on the thing because they only are allowed to at maximum to send 20 items to the ballot per the charter. But it's in the charter now. So it sounds like there's only an appetite for 15 from the commissioners. So hopefully we will be one of those 15. We have support from the outgoing, now he's the acting managing director, who is the LGBTQ liaison for the mayor, Krishna, and the mayor's office itself. And we thank everybody that submitted testimony. And we'll be on the lookout for that next phase when we have one more time to testify before the commission to make sure that this keeps on moving forward.
Thank you, Michael. Do you have any public testimony update on City and County of Honolulu proposed charter amendment to create a CNC Honolulu LGBTQIA plus commission? Nope. All right, great. Next, we have update on developing written protocols, procedures, and record keeping for the commission. Shanda, now it's your turn.
Aloha. I put in the board packet. And again, this is very short. We have way more policies and protocols, but this is the beginning of it. If anybody is disturbed by the format, feel free to reach out and let me know. If there are specific things you want me to focus on first for the next few things, let me know. Otherwise, I will keep you posted as I add to it.
All right, do we have any public testimony on the update on developing written protocols, procedures, and record keeping for the commission? No, all right, next we have our 2026 Pride events. First, we have report on Governor Green to fly pride flags at the Capitol and to issue a proclamation declaring June Pride Month in the state of Hawaii. As most of us know, the flags are up, proclamation has been given, and we are in the process of celebrating Pride Month. So happy Pride, everyone. Let's see, do we have a report on that, Michael?
Just that we will have copies of the proclamation to give to Kauai Pride, Maui Pride, and Hilo Pride. Kona and Honolulu don't get one because they're not in Pride Month.
Yeah. All right, next is Pride schedules for the state of Hawaii. We have Hawaii Pride, which is coming up on June 6th. We have Maui Pride coming up on June 13th. And then we also have Hawaii Island Pride, June 27th. We have our two other prides. Honolulu Pride is October 17th, and our Kona Pride is September 19th. So those are going to be the Pride dates for celebrating this year. Keep in mind that for Honolulu Pride, it is a month-long celebration. I believe Maui Pride, they do a couple of weeks. So it's not just one day in several places. So, all right. Next, we have commission.
Wait, hold on. Well, we can't blow through this. We need, because this is our last time of meeting before we actually travel. So for Kauai Pride, it's going to be myself, Rick, Joe, and Chris going. We're luckily we're going to be coming in on all the same flight that morning. I just got emailed our unit number for the parade. We are unit number 24 for the parade. We have a pickup truck. It's a full-size pickup truck that Rick is going to be the driver of for that. Shonda, I do need to get the magnetic signs from you, the banner, and the poles so I can bring those with me. We will have fans for everybody for all the prides. We ordered the 3,000 fans. So we're not taking all 3,000 to Kauai. Everybody's gonna get like 500 for each event. And then for Maui Pride, it's Kat, myself, and Chris going. Chris is going to have to hang out at the airport, I believe, for a little bit before we get there. Kat and I show up, and Hannah's shaking her head yes. So yeah, and then we'll meet Joe at the festival spot. We get there around 2-ish, I guess, to give us an hour to set up, and then Kat and Chris will leave first. I will stay behind since we're supposed to. They don't want us breaking down till 8 o'clock. But I got I will hang out there as long as possible and then take everything back with me for Maui Pride. And then Hilo Pride, it's Kat, myself, and Chris is going to meet us there. He's going to drive over from the Kona side. Hanny's checking on him, getting his mileage. Is there anything we need to do to make sure he gets mileage for that for Chris, since he's driving all the way over there and all the way back, and we're not going to be renting a car, so he's agreed to pick us up for that. So, and I need to follow up with him to see if we have a table and chairs and tent for Hilo Pride. So that's where we're at there. Does anybody have any questions from the commissioners that are traveling about this?
I do.
Okay, Joe.
Michael, are we actually walking or riding in the Kauai parade?
Kauai Parade, we have them down for a vehicle, so we're gonna be able to decorate the vehicle. I'll bring stuff to decorate the vehicle. So if you don't want to walk, you can ride in the vehicle with Rick, since Rick will be driving. And then probably Chris and I will have the banner out in front.
Okay. Yeah. Question. I understood that we were getting an SUV. Now it's a truck.
There were no SUVs available when Hanny made the reservation. But yeah, it's a full-size cab truck.
Okay.
So we're not going to be, even though it's Kauai style, we don't have to ride in the back of the truck to get around.
Okay.
So there's that. Yep. And like I said, I'll have the fans, the stuff, other stuff, and because we do have enough stuff for on the last weekend of the month. We have a full set of everything for tabling. So for the AIDS walk, so I can give that to Shonda for because Chrissy will be joining Shonda at the AIDS walk on the last weekend. I did put out the invite to the Youth Commission as well as the Commission on the Status of Women if they or commissioners want to join us in Kauai, Maui, or Hilo. So they're still working on that and see if they're going to join us or not. They want to walk with us. So.
All right, so all of that was going into what I was moving into next before I was interrupted. Commission representation at Hawaii Pride, Maui Pride, and Hawaii Island Pride. So all of that we just talked about goes under that. All right, next is update on swag for Pride and tabling events.
We already covered it all.
Say that again?
We've covered it all. Got the fans, we got the stuff, we're all good to go.
All right, perfect. Do we have any public testimony on any of our 2026 Pride events? No? All right, great. Next, we have discussion on attending 2026 Gender Journey Days and support for commissioners. Shanda.
Aloha, and we are supporting this year's Gender Journeys Day again, which is excellent. And I sent our information for myself and Rick and new oncoming commissioner, Chrissy Doyle. So the three of us are going to be attending. We do have 2 more paid slots if anyone else on the commission would like to attend. You're going to go? Okay.
Yeah.
Excellent. So if you can send me your t-shirt size, the email you want me to give them, and if you have any nutritional requirements, and in a text or email, I will send that. Anyone else want to go? Good for educators, good for healthcare providers, and of course, family members of transgender or gender expansive youth. Anyone wanting to go? Okay. Thank you all.
All right, thank you. Do we have any public testimony on discussion on attending the 2026 Gender Journey Days and support for commission? Nope. All right. Next, we are finalizing tabling of the 2026 Honolulu AIDS Walk. Shanda and Chrissy are going. I'll be joining both of you for that day as well. Any other updates for that?
So you said, Michael, that you can get me this stuff when I get you the polls and everything after the prides. You can get me that, or are you gonna? I don't mind bringing it down.
Oh, what do you call it? Because I need to get the polls from you this week. So when you give me the polls and the magnetic signs and the banner, I can give you a set of stuff since we have the 2 sets now.
Super.
No, Shanda, I have a banner and some polls that I got from you when we did the geriatric, the Kapuna Fair. I have a banner and some PVC piping. Was that what you're talking about?
Oh, I thought Shonda. Yeah, that's what I'm talking about. That's what I need to.
I have and so I thought, Michael, I thought I was going to bring it to you in Kauai,
and
then you were bringing it back.
Yep.
Is that right?
Okay. Yep. If you have it, then Shanda, do you still have the magnetic signs?
I do.
Okay, so I need to get those from you.
Yeah.
Okay, so I have the big tarp that I used at that Kapuna Fair.
Okay.
That I used on the table. Is that's what you're talking about, right? It's a big tarp it has gossets in it, and there's some white PVC piping that's attached to it. That's it.
Yeah.
Is that what you mean?
Yep. And it has.
I don't know how you attach the I'm assuming you know how to attach it to the PVC pipe because there's no ties or anything.
I have the zip ties, so it's done deal. So as long as you have there should be 6 connectors, 2 T's and 4 L's for the PVC pipe, and there should be 4 4-foot pieces and 3 3-foot pieces to put the frame together. So that's the PVC pipe.
Wow, I'll go look and see. I didn't
this
use
is
the
something that
PVC
needs to be in the
pipe, so-
protocols.
Yeah. Yeah,
How to, some
I
assembly
didn't use
required.
it. Yeah, all I did was yeah, I just used the tarp as on a table. So I'll look and see what there is. I'll
Okay.
text you if there's some problem.
Okay, and that's the one that has the state seal on it, the banner.
Yes, it did. I'm
Okay.
pretty sure. I'll double check.
Okay.
I can go do it now.
Okay, I have a question for the AIDS walk. I know it's on the end of the month of the 27th. What time does it start? Because I like to try and get there, but
It starts like 8 a.m., right?
okay, so I gotta
7 a.m.? I don't remember.
8 registration starts at 8, the walk starts at 10.
okay.
Yeah, so 8 a.m.
I gotta try to figure out
All
this
right.
twice.
All right. Any other questions? Nope. All right. Did we do public testimony for that one? I forgot now. Public testimony on finalizing tabling for the 2026 Honolulu 8th Walk. Great. All right. Next is review draft of the required 2026 report to the legislature. Deadline for updates to the report was May 22nd. I believe most everyone got them in.
I didn't get. This some that I didn't get. Joe?
Joe, we still do not have your report for the legislative tracker. It's literally just what you've done this year and what it's been, you know, what you've done as being a commissioner. So just a synopsis of what you've done. Rick, you're the other one. So make sure the two of you can they get those into you by say Wednesday this week.
Okay, I'll need to find that again.
Yeah.
Thank you.
So that and send that to her by Wednesday. Okay. Both Joe and Rick. All right. Let's see here. Do we have any public testimony regarding the review draft of the required 2026 report to the legislature?
Before we move to the public, just everybody that hasn't read the report yet, go back. I hope you will go read the report. We do actually, there's stuff that needs to be inserted and into it. We are a summary of what happened this morning. The ceremony of the flags at the Capitol. We also will need a summary from Kauai, Maui, Hawaii Island, and the AIDS Walk to be inserted into the report. And then we will be doing Sandy, if you were going to do the summary, that needs to be written as well before the end of the month. Because when we meet next in July, we'll be voting on the finalized version of the report to submit to the legislature. And so if there's anything else anybody wants to add to anything else, we did go and change it a little bit. We did major projects and then our legislative efforts and then everybody's reports. So if there's anything else anybody wants to have added, tell Hanny and get her in what format you want it. If there's anything else on that one. Okay.
Yeah, I have a question. So are these two items related? So the thing that Joe and I are sending in, is that something that gets compiled into the report? Is that what you're saying?
Yes, that's from each commissioner. Yes.
Got it. Thank you.
Yes.
And a reminder, this is going to be sent to the legislature and the governor, and it's going to be put up on their website, and it will be there forever. It's part of the permanent.
This is public record.
Yep.
Yeah. All right. Do we have any public testimony regarding the review draft of the required 2026 report to the legislature? No. All right, great. Next, we have the 2026 campaign to encourage voter registration and voting in the primary and general election from members of the Mahu LGBTQI plus community and QT5 community, QT5 plus community.
Okay. If you notice in the board packet, I sat in on a brainstorming session about this with a couple other different groups. These were some of the things that came out of that. So I just wanted everybody to see that and hopefully that will spur people into action. that and if you and then on the fans, on the back of our fans, it has the QR code to clear the vote, which takes you directly to voter registration in the state of Hawaii. So at least we're starting that, especially with that going to the Pride celebrations, making sure people are registered to vote. We have that there. I was in conversation with Indivisible Kauai. They will be doing voter registration at Kauai Pride, and I'm going to check with Maui Indivisible, see if they're going to be at Maui Pride to see if they're going to do voter registration. If not, I will grab voter registration forms to bring with us for Maui Pride. And
Excellent.
same thing for Hilo Pride. So.
Excellent. Thank you, Michael. Next we have, sorry. Go ahead, Shanda.
Thank you. I wanted to say thank you. This is all super awesome, Michael. I love it. I have a couple ideas. I was trying to think since the last commission meeting, well, what could we do? And I was talking to people and brainstorming also with the idea of getting influencers. I am old and I don't know who the influencers are in our community that would jibe with us. But if people know people that are respectable and respected, getting them to reaching out to them and encouraging them to include these messages, I think is helpful. And I think that we should remember as a commission, as often, and easy for me to say because I don't post anything, but anytime we post, if there can be a link to register to vote here, or a QR code at the bottom of our materials, any little thing. And I'm totally going to bring my iPad to all of the events that we go to this summer so that I can help people register right there on the spot if anybody's interested. And anything we can do to encourage people to vote and to normalize it and to emphasize the importance of how voting affects our community. And it's real. It's not something that happens on the mainland. It's stuff that affects our lives here. So thank you, Michael.
All right, any other commissioners? No, all right, great. So next we have public testimony on 2026 campaign to encourage voter registration and voting in the primary and general elections for members of the Mahu LGBTQIA+ and Cutie Pie Plus communities. No, all right. That leaves us out of old business. Next is new business, which we have none of. So we're moving on to next, which is future meetings and topic speakers. Right now, we have discussion on inviting government and non-government organizations to present to the commission. For July 2026 meeting, we still need someone for that. If y'all have anyone, I have a couple of ideas, but if anyone else, please let me know if there's anyone that y'all would like.
Yeah, hopefully the insurance commissioner if we're lucky.
Yeah, that's what I'm hoping. Yeah. All right.
Sandy, do you want to do that invite or do you want me to?
Well, I can reach out to him after the meeting if you want.
Okay.
I'll just give him a call. Yeah, I'll just give him a call and talk to him. All right, let's see. Do we have any public testimony on discussion on inviting government and non-government organizations to present at the commission? Or to the commission? All right, does not look like we have anything. So next is we have adjournment. Do we have a motion to adjourn?
Wait, before you do, just I remembered because she caught me turning my camera off. I remembered the other person I said I forgot to thank was Erin. She's done a yeoman's job of dealing with a lot of new issues and handled our learning curves very well. So mahalo's Erin, Erin Lau was our, and Kristen and Hannah, thanks so much. Okay, bye.
Thank you. And thank you, Janelle, for showing up today. We hope to see you at some of our other commission meetings. Thank you. Janelle Fujinaka, everyone. All right, next. Okay, do we have a motion to adjourn?
Before we adjourn, I just want to see if Kat wants to say anything else since it's also her last meeting as well.
Oh, no.
Sorry, Kat.
All good. I'm not going anywhere. I'll still be around. If you ever need help, feel free to call on me.
Mm-hmm.
Thank you. Have a safe journey back from Indiana.
Yeah,
all
thank
right.
you, Kat and Joe.
I did want to say that I did see Janelle give us the shaka when she drove by this morning at 6:45. So thank you, Janelle.
Oh yeah, and thank everybody that showed up at 6:45 this morning. Oh.
Yeah,
Joe,
that
yeah,
was
several
early.
people.
Thank goodness for sunglasses. All right, do we have a motion for adjournment?
So moved.
So moved.
All right, do we have a second?
Safe flight, everybody coming over to Kauai.
Do we have a second?
Second.
Thank you, Michael. All right, discussion on adjourning. No, any public testimony on us adjourning? Anybody not want to leave? All right, great. So let's vote. Anyone who objects to adjourning? Any abstentions from adjourning? All right, looks like we unanimously are adjourning. I hope you all have a wonderful Pride Month. Enjoy the Pride celebrations that you're going to this month. I'm very excited that here in Hawaii, we don't have as much to worry about cancellation. So enjoy yourselves and we'll see you in July. Thank you, everyone.
Everyone.
Thanks again, Jeanette.